Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Want to prevent back pain? Reduce sitting time. A new study from the University of Turku in Finland showed that reducing daily sitting prevented back pain from worsening over 6 months. The result strengthens the current understanding of the link between activity and back pain as well as the mechanisms related to back pain. Intuitively, it is easy to think that reducing sitting would help with the back pain, but previous research data is surprisingly scarce. The study from the Turku Pet Center and UKK Institute in Finland investigated whether reducing daily sitting could prevent or relieve back pain among overweight or obese adults who spend the majority of their days sitting. The participants were able to reduce their sitting by 40 minutes per day on average during the 6-month study. Our participants were quite normal, middle-aged adults who sat a great deal, exercised little and had gained some extra weight. These factors not only increase the risk for cardiovascular disease but also for back pain, says doctoral researcher and physiotherapist Juha Norha from the University of Turku in Finland. WHO launches Global Strategic Preparedness, Readiness and Response Plan to tackle dengue and other Aedes-borne arboviruses. The World Health Organization launched the Global Strategic Preparedness, Readiness and Response Plan to tackle dengue and other Aedes-borne arboviruses. The plan aims at reducing the burden of disease, suffering and deaths from dengue and other Aedes-borne arboviral diseases like Zika and chikungunya by fostering a global coordinated response. The plan outlines priority actions to control transmission and offers recommendations to affected countries across various sectors including disease surveillance, laboratory activities, vectoral control, community engagement, clinical management and research and development through a whole of society and regional approach. An estimated 4 billion people are at risk of infection from arboviruses around the world, and this number is estimated to increase to 5 billion by 2050. Dengue cases have surged across all 6 WHO regions and the number of cases has approximately doubled each year since 2021. With over 12.3 million cases as of the end of August this year, almost double the 6.5 million cases reported in all of 2023. In December 2023, WHO graded the current global dengue upsurge as grade 3, the highest level of emergency for WHO to support countries to strengthen their surveillance capacities and implement response activities. WHO approves first Mpox diagnostic test for emergency use, expanding global reach. The World Health Organization has listed the first Mpox in vitro diagnostic under its emergency use listing procedure, an important step in improving global access to Mpox testing. The approval for emergency use of the Elinity-M MPXV assay manufactured by Abbott Molecular Incorporation will be pivotal in expanding diagnostic capacity in countries facing Mpox outbreaks, where the need for quick and accurate testing has risen sharply. Early diagnosis of Mpox enables timely treatment and care and control of the virus. The presence of the monkeypox virus is confirmed by nucleic acid amplification testing such as real-time or conventional polymerase chain reaction, as stated in the WHO interim guidance on diagnostic testing for the monkeypox virus. And the recommended specimen type for diagnostic confirmation of monkeypox virus infection in suspected cases is lesion material. Study unveils connection between snoring and elevated blood pressure. Nature Medicine. Australian research has found a link between snoring and elevated blood pressure. According to the study, which was conducted by sleep scientists from Flinders University in South Australia, people who regularly snore at night are more likely to have elevated blood pressure and uncontrolled hypertension. The study found that 15% of 12,287 participants snored for more than 20% of the night on average over a 6-month monitoring period, and that those with high snoring levels had a 3.8 mm per Hg higher systolic blood pressure and 4.5 mm per Hg higher diastolic blood pressure than participants who did not snore. The Flinders University study was the first to use multiple night home-based monitoring technologies over a prolonged period to investigate the link between snoring and hypertension. Participants in the study were middle-aged and 88% were male. For the first time, we can objectively say that there is a significant connection between regular nighttime snoring and high blood pressure. Bastien Lichet, lead author of the research from the College of Medicine and Public Health at Flinders University, said in a media release on Wednesday. WHO recommends maternal vaccine and antibody shot to prevent RSV in infants. The World Health Organization recommended vaccinating pregnant women and administering infants with an antibody to prevent severe respiratory syncytial virus infection in newborns. Respiratory syncytial virus, which typically causes cold-like symptoms, is a leading cause of severe infection and death in babies and older adults. A majority of respiratory syncytial virus-related deaths occur in low and middle-income countries, with about 1,01,400 annual deaths in children under the age of 5, according to WHO. WHO recommended a single shot for pregnant women in the third trimester that typically starts at 28 weeks to protect their babies. Pfizer's respiratory syncytial virus shot opens new tab. Respiratory syncytial virus shot, sold as Aedes-borne, is the only available vaccine in the United States and Europe for use in pregnant women. It is also approved in a few other markets such as Japan and Canada. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.